Hello doctors, today we're going to talk about the bile duct stricture. So, bile duct stricture is a narrowing or constriction of the bile ducts, which are tubes that carry bile from the liver and gallbladder to the small intestine. This narrowing can cause backup into the liver and can lead to variety of symptoms and complications. Bile duct strictures can be classified into several different types based on their location and cause. So, benign strictures, these are strictures that are caused by non-cancerous conditions such as inflammation, trauma, or scarring. Malignant strictures, these are strictures that are caused by cancer or tumors or other tumors in the bile ducts or surrounding organs. Intrahepatic strictures, these are strictures that occur with the liver, usually as a result of inflammation or infection. Also, we have extrahepatic strictures, which are strictures that occurs outside the liver, usually in the common bile duct, which is the tube that carries bile from the liver and gallbladder to the small intestine. We have primary stricture, which are strictures that occurs on their own without underlying diseases or condition. We have secondary strictures. These are strictures that occurs as a result of another disease or condition such as chronic pancreatitis or liver cirrhosis. The signs and symptoms of the bile duct strictures may vary depending on the location and severity of the strictures. Some common signs and symptoms may include, for example, jaundice, abdominal pain, itching of the skin because of buildup of bile salts, maybe nausea and vomiting will be present, pale stool and dark urine, like stools will become light colored or white, while the urine will become dark color. Fever also, if there is any infection. Weight loss also, due to buildup of the bile in the body. Complication of bile duct strictures maybe include cholangitis, liver damage, pancreatitis, and gallstone. To diagnose bile duct stricture, usually the diagnosis will involve a combination of imaging tests and blood tests. In some common diagnostic methods include, for example, CBC, liver function test to detect the sign of infection, imaging tests which can help to visualize the bile duct and identify the presence of stricture, ultrasound also it can be used at MRCP, CT scan can be used, ERCP also. A biopsy of bile duct tissue may be performed to determine the cause of stricture, but we should not forget that the diagnostic method used will depend on the suspected cause and location of the bile duct stricture. Okay, the treatment for bile duct stricture depends on the cause, location, and severity of the stricture. In some cases, stricture may resolve on its own, but in the most cases, treatment is necessary. Some common treatment methods include endoscopic dilation. This procedure involves the insertion of a flexible tube with a balloon on the end into the bile duct. The balloon is inflated within the stricture and improve bile flow. Another method for treatment, you have stent placement. A stent is a small tube that is inserted into the bile duct to keep it open and improve bile flow. Surgery in some cases may be necessary to remove the stricture or repair the bile ducts. Chemotherapy or radiation therapy if the stricture is caused by cancer. Chemotherapy or radiation therapy may be necessary to shrink the tumor and improve the bile flow. After the treatment for the bile duct stricture, it's important for the patient to follow a healthy lifestyle and diet to prevent recurrence and improve outcome. Some lifestyle tips may include eating a healthy diet, maintaining healthy weight, exercise regularly, avoiding alcohol again, and of course smoking. Also taking medications as prescribed. At the end, it's important to work closely with the doctor to manage the bile duct stricture and maintain optimal liver health, and never ever forget about your yearly tests and analyses and go to your doctor regularly. Thanks for attention. Thanks for hearing. That was all. Goodbye.